Ми – україно-швейцарський проєкт «Розвиток медичної освіти». Біжимо цей марафон у 4-й прикінцевий рік першої фази проєкту. Долучайтеся до наших забігів щосереди. Ми висвітлюємо те, чим живуть медичні освітяни, лікарі, медсестри, а також студенти-медики нашої з вами країни та світу. Ми прагнемо спільно пробігти цей марафон і обговорити важливі для вас теми, рішення та виклики. Розвиваємося разом для якіснішої охорони здоров'я.
So let's start. So Martin, good day.
Hello.
How was your tea, or maybe did you have any tea?
I have a cappuccino, and
It's better.
I can recommend this place.
Thank you. Now, okay, let's talk maybe a bit about your personality, if you will feel comfortable, and let's talk, of course, about medical education development here in Ukraine and maybe at all in Western Europe. So just if you can tell me what the person from Basel is doing here in Ukraine for so long time. Why you are here?
You know, depends on where you want to go back, but
Okay.
there is road vocations in life where you don't know whether you're going right or left. So it all happened in 1999 when I was first asked to come to Ukraine to do a study on a situation of maternal and child health care in Ukraine and how standards could be improved. That's how it all started. There was a delegation at the time from the Ministry of Health who addressed the Swiss embassy and asked for some support and collaboration. And that's why the Swiss embassy got to us, the Swiss Tropical and Public Health Institute, where I was employed at this time. And then I was asked to come here and to take a look at what the situation is in terms of maternal and child health care. That's how it started.
But okay, thank you. Interesting that you decided to know more about healthcare system if and when you have another education at all. I know that you're an engineer. Is that true?
The engineering education, that's in my former life, basically. Yes, I did a degree in biomedical engineering, but soon I started to work more in public health, so in healthcare organization. So the question was certainly about what does it take in order to improve healthcare services. And in the beginning, when we came here in 1999, it was all about infrastructure. It was about new medical equipment. So at this time, 1999, so it was hardly 10 years after the independence of Ukraine, still living more or less with one, sometimes 2 foot in the old Soviet times. And during that time, there was also quite a bad economic situation, so Ukraine could not afford to buy modern medical equipment that you needed, especially in order to take care of young infants, newborns, especially critically ill newborns. For that, you need medical equipment for breathing support, for injections. It's quite specialized equipment. So since I was seen as a medical equipment expert at this time, so I was asked to take stock of what the situation is, what's in the country, and what is needed, and then to write a report on behalf of the Swiss government and asking for Swiss government funds in order to purchase new equipment. That's more or less where it started and where my education in biomedical engineering was quite relevant. Whereas, of course, over the period of time, it's quite some time ago, in 1999 already, 30 plus years, things have changed a little bit. I went into different education. I had another degree in public health, and I specialized in different things such as digitalization and healthcare.
In previous life, I was a journalist, and I know that if you are a journalist, you will be all your life, all long life, you will be curious, and you just need to know the truth. So even now, if I do something else in another occupation, I stay curious because it's just about myself. So maybe do you have some characteristic from your mind as an engineer? So what helps you to be a great, effective manager here, now, in another sphere?
That maybe boils down to the fact that I was never 100% engineer in my deep soul. Right?
Okay.
So I was always interested in different subjects matter, and I never wanted to specialize very vertically. That's also why I studied biomedical engineering, which is already not pure mechanics or electronics, but it takes into account medicine. You have to know a bit engineering sides of electronics, of medical engineering, of mechanics, but at the same time that is applied to a different thematic area, such as biology or medicine. So we had already quite a broad education, and maybe that is part of my nature of wanting to know a little bit more in a broader field of where things are going. And when in the beginning we were talking and working a lot with medical equipment, soon of course you realize if you work not only in manufacturing of medical equipment, but if it's applied medical engineering, you learn quickly that it's not enough just to put a piece of equipment. Yes. That doesn't help the situation. So if you don't have a more systematic view, then a system-oriented view, then you dump some equipment, but then the equipment sometimes sits and cannot be maintained, or it's not the equipment that can appropriately be operated. The language of instruction is not right. There is so many other supplies that are coming that probably a country could not afford, such as it was in the early times. So you have to get interested into more the human resources part that is connected to technology. You get into logistics, you get into regulations, under what regulations should an equipment be operated or not. What does medical staff, nursing staff has to learn in order to operate the new equipment? What medication has to come on board in order to appropriately take care of young infants? So it's automatically already, if you work in healthcare, you better not very much deep into one subject matter, except maybe that you're a surgeon in child heart surgery. But if it's much more program management that I was interested in, you have to be oriented towards more the broader issues, the issues that are connected to technology, the regulations, the politics, if you want, even sometimes.
Okay, thank you.
Yeah.
What was the situation in Ukraine in healthcare at all in that time when you just were first arrived here? What did you see? How can you describe it?
There was quite a discrepancy of how a hospital looked like from the inside here compared to Switzerland, for example, in terms of how, in terms of modernization, in terms of what equipment would be found, in terms of number of staff, and so on. So simply, Ukraine inherited the culture, the medical culture from the Soviet Union time, which was different because of different resources, of different technologies, of a different mindset of people, different protocols that were used in medicine. So if you were, a pregnant woman coming, having your baby delivered here in Kiev, that certainly would be a different experience as if you had it done in Basel or in Zurich. So it's on many fields that we could observe the differences. But certainly what we could see is that there was a big need in terms of supply of medical equipment, because we wanted to bring down the mortality rates of mothers delivering and the mortality rate and the type of diseases in young children that are born. And that is only possible with new approaches in terms of medicine, in terms of medical equipment, in terms of clinical protocols and so on. So we tried to leverage a bit the difference from what we have seen and experienced in Western countries and those countries that really still had the pregnancy of the Soviet Union time.
What can you see now, if we can compare that time and nowadays? What if we can say, can you see any progress right now in our medicine and healthcare system?
It's not the progress only in medicine that we can see. It's meanwhile 30 years had elapsed, and the country has evolved greatly. I mean, if I think about my first times here in Kiev, where I was housed at the Dnipro Hotel, a hotel from the Soviet time with old Soviet
so
standards,
brave
where
to
in
live
winter time
there.
you were freezing. And now you have so much choice of modern hotels. The streets have improved, the services are improved, great restaurants. So it's not only the development that you could see in one area, but it's in the entire society, and obviously also in medical care. There were great leaps of developments now achieved, and if you go to some hospitals, you would hardly see any difference between a hospital in Switzerland or here in Ukraine.
I know that doctors maybe for 10 or 20 years ago, they were so afraid and they were so maybe closed and they didn't know what will be tomorrow. What can we say, how can you describe modern doctor for nowadays in Ukraine?
There's probably again changes on various levels. First of all, I guess the doctors of today are more collaborative, they're more patient-oriented, they're more open because there is now access to international know-how. The internet that evolved over that period of time certainly also helped to get connected to other fellow colleagues and to get access to journals, to more up-to-date know-how. And I guess there is a sort of a leverage that you can see. I mean, Ukrainians can freely travel and can go to other countries and collaborate and visit conferences that automatically, I guess, has an effect on how the situations in neighboring countries are also evolving.
Can you tell us more about the Ukrainian Swiss project Medical Education Development?
Sure. So this project started now 3 years ago. We had in 2016, I guess, the first mission where we studied the situation in terms of need for intervention in medical education. That was amended again from the Swiss government in collaboration with the Ministry of Health to look into this matter. And after 1.5 years of preparations and outlining the project, so what's in, what's out, and what are the modalities, then we started implementing this project 3 years ago. So the Swiss Ukrainian Medical Education Development Project has as an objective of improving the educational sector for medical doctors and for nurses. Not for every profession, but we agreed to address more the fields of primary care professionals, meaning family doctors and nurses. This is one wing, one component, as we would say, of the project, taking care about improvement of education for those professionals in medicine that are directly concerning the patient interaction. But at the same time, we realized that good medical services depend on good management of the facilities and more the governance of the system, as we would refer to. And that's why we have, as a second component, one component that addresses better education and a new education program for healthcare managers.
Do you have maybe any university or academy, if we talk about educational system now, or just trainings? If you can describe what are you doing with doctors, how did you, if we talk about education?
You mean what partners we have?
Yes,
we're
yes,
working
yes.
with?
About
So
your
we selected a number of universities. It was a competitive process when we selected our partners, and we wanted to have only those partners where we were convinced that they're really interested in changing. This process allowed us to select some of the most advanced universities that really were ready to change in terms of mentality, in terms of how to construct the education program, to change curricula and educational approaches. So that's why we have 6 partners now with whom we are working, and this partnership proved to be quite quite fruitful, I would say. It's not only that we work with universities, but at the same time we work also with the Ministry of Health, because a lot depends on norms, regulation, on policies, and of course it's necessary that the Ministry of Health has the overall guidance of what is happening in the field of medical education, beside maybe also the Ministry of Education and Science, who is also having a certain role here.
Okay, so you have partners. If we talk about universities, what are your topics? What our medical, what our doctors, what they are studying?
There's several areas that are of interest for us. So first of all, you know that if you want to become a doctor, you have to study medicine. So that's program, that's what we call undergraduate education. And we are specifically interested in the final 2 years of education, where a medical doctor decides what specialty to follow. So you can, as a medical doctor, once you have passed a more general education, you can decide to become a surgeon, become an ophthalmologist, a psychologist, a family medicine doctor. And we were interested mainly in this field of primary care, so automatically we were interested in improving the education for family medicine doctors, for specialists. At the same time, we realized that nowadays, since specialization is, and technical and scientific involvement is going so fast, that it is best to have teams working in primary care and sort of distributing up the task between medical doctors and nurses, because nurses nowadays play a very important role in taking care also of certain conditions of patients and reaching out to population in more rural areas or in taking care of populations at home, to making home visits. So to cut a long story short, so in this field of undergraduate education, we were trying to foster the image of family medicine, because in many views, family medicine had not been so attractive for bright students. They were rather going into more prestigious areas such as surgery or becoming ophthalmologists and these kind of things. So we're working quite hard in convincing the young medical doctors that becoming a family medicine doctor is a very good thing to be done, and it's a very versatile and an interesting field, and it needs a lot of professionalization. First of all, we are interested in the undergraduate education program, whereas in the final 2 years, you make a decision about whether you would become a family medicine doctor. But then once you're finished your general studies, you go into a program, a postgraduate program that specializes you. And that's called Internatura, and here we have a number of inputs where we try to improve that field where practical education is needed, the hands-on working with patients to train some interventions that are important. And for that we have a number of interventions, such as the simulation training centers that are now quite a gold standards in training on a professional level, skills-oriented, competency-oriented young doctors.
What do you think right now, maybe what is the main challenge for if we talk about Ukrainian mentality? We were talking previously about our mentality Ukrainian. So what do you think, what is our main challenge for our Ukrainian people for nowadays?
Maybe let's go back to the question about what are the challenges for medical doctors.
Yeah, okay.
And what is the challenge for the medical system, for the quality of the care system. I guess the challenges are on multiple levels. One of the challenges certainly is that there is in Ukraine a low level of resources available. So for example, in terms of GDP, of course, Ukraine has probably a GDP that is 10 times lower than that of Switzerland. That means also in terms of what is available for the healthcare sector is only also a fraction of that percentage. So automatically that translates into scarce resources that are available on the healthcare sector, which translates again into the difficulty that you cannot pay adequately medical doctors. So the gap between the salary of a medical doctor in the Ukraine compared to Poland, compared to Germany, compared to Switzerland is really also a fraction. And that is one of the problems, because also here the problem is high migration of qualified staff that would leave for other countries where, you know, working conditions and salaries are much better.
I know that you used to work with maternity, and you mentioned, and you had a project who helped to mothers and children in Ukraine. Can you tell us more about it?
Yeah. That was not only a program, not a general program for mother and children. That was called perinatology project at this time. So it was focusing around that area. A child is born, I mean the final weeks of pregnancy of a mother, and then the child is born and the young child needs to be taken care of. That's what is called and referred to as a perinatal period. So we were taking care about better medical services for mothers, for pregnant women with complications, and for children that also had severe challenges, health challenges. But that was quite a technology-sensitive area where we had to make sure that the appropriate equipment is there, that the support system for equipment is there, that new guidelines are being developed, that there is an international exchange about professionals that exchange their opinion and their professional view on how certain interventions should be done in this critical field for mothers and young children.
Why did you finish this project?
Because the project has a beginning and the project has an end.
Good answer.
So that's the nature of the project. You identify a challenging area, you agree on what should be done, and then after a certain period of time, you should have counterbalanced the challenge, and then a project is finished after a period of time. And I believe it was a relatively long period of time of collaboration. We had a collaboration for maternal and child health care over 15 years of time, which is quite a long period of time for an international project. But I believe that we achieved the objectives that we have set ourselves at this time.
I know that you're a family man. If we talk about maternity and about children at all, you have two sons.
I have two sons.
Maxim and Koля.
Yes.
I think it's more Ukrainian name, no? Koля and Maxim, no?
So I hope you're not insinuating that I have a Ukrainian wife. No, my wife is German, but she studied Russian, and we had a fable for Slavic names. So it's simply for that reason that we gave our two sons also Slavic names.
What is the main, like secret to be a good parent for you?
Wow, so I'm not sure if I discovered the formula of being a good father.
Yes.
I tried my best, and
yeah, understand.
In nowadays time that's also not so easy, especially to accommodate a challenging profession, a working life with my expectations also to be available for my children and to help my wife in bringing up the children. So I guess that's every parent that has to strike this balance and to make sure that you have enough time for your children, but at the same time not neglecting your profession, and at sometimes you also want to have a little bit of a private time, which is
private time,
also again not so easy.
Did you have any big challenge for you as a father? Because you're a good specialist in healthcare. What about this fear?
Luckily, we did not have big challenges in terms of having children that had difficult diseases or whatever kind of challenges. So we were lucky to have two healthy boys that developed nicely, that are quite lively. And as they grow older now, 9 and 11 years old, of course you get all sorts of challenges in balancing their growing interests in different things. There's also this this need and this kind of of pressure from peer groups also to play these online games. And as a parent to balance these kind of new challenges that come in more educating your child and making sure that there's also a healthy balance between what they are doing and taking enough time to study in school. That's what I see quite as a challenge.
Did you have any dream who you want to become when you were a child? Maybe did you think about medicine? No?
I cannot remember really. It was a sort of a natural evolution. My father was at this time also a technician, electrician, so I got a bit interested in technologies, and probably that my career was a bit influenced by doing practical things, because at my home I had a workshop. My father had a workshop, and I could do very practical things, and I like to do practical things. When I was younger, at 16, I had a motorcycle, and tinkering on the motorcycle and doing practical things. I guess that's why I liked at this period of my life, and that's how I got more into the technology area. And then the interest for other things came later when I did enter the university and did my continuous education plans.
Do you have any motto, like a big person who influences on whole healthcare system of Ukraine? Maybe you have some motto, no?
I would not know about a motto. I like to see myself as an optimistic person, and I like to work together with people. I guess it's probably not a motto, but I'm challenged, and what I like is to have lively interchanges with people that have different opinions and different viewpoints, and to see how these different viewpoints could be accommodated, and where you can build a common ground of finding out what the next way is of taking on challenges, and that's something that we encounter in our day-to-day life also in the project. Different people have different points of view, and you need still to come to an agreement of what's in your project plans, what interventions should be done, which ones should be not done, what are the level of prioritization, these kind of things. So I guess I'm quite stimulated, and I'm quite a bit passionate about these ways of working together with people. So I guess in the beginning, as you have seen, I was much more interested in technologies and doing things with my hands and getting things done. And meanwhile, I have a job that is much more on the level of bringing people together, of fostering development. That's where I am at the moment.
What are you believing in? Yeah.
That's a big question, isn't it?
I know.
But in the context of where we are here in Ukraine, I believe in the good evolution of humankind and of more a humanity-oriented future. And I have seen big steps in evolutions in the Ukraine, and I believe and I hope that not only Ukraine but other countries also will go along this way of having more democracy, of having more patient and people-centered services, of making sure that the happiness as a whole in the population is growing. Let's put it like this, even though it sounds a bit blunt.
Good, it's so warm here after your words, so it's really good. I know that your colleagues, they said me that you like to use the phrase, let's massage. What does it mean?
Well, I don't know if I use that that phrase quite often. It comes to me as a surprise. Probably I have used it, but it's simply a way. Probably connects to what I said before. That when you come together with people, you need to find common ground. And certainly, if I have a certain conviction, I want that people follow my lines of arguments and my way of seeing things. So massaging means also that bringing in my point of view into the discussion in a way that it's most acceptable for other people.
It's good motto, you know. Let's massage. You should to think about it. Thank you very much. So that's all. Thank you very much that you were with us. Well, the interview is being held as a part of the marathon on medical education on Wednesdays from November 10, 2021. Thank you, and I think and I suppose to be continued. We were talking a lot about our Ukrainian medicine and healthcare system, but you know, we are talking and talking. We need to show you what we can make to, if we talk about future. So, if we talk about our future in Ukraine, future of healthcare system, I would like to ask you to make some plan.
You could certainly make a plan.
Yes,
But
I
you
know.
see, I've learned.
Yes.
I like technologies, and
Yes.
of course,
Because you're
I
an
have
engineer.
2 boys. I have 2 boys that like to do this kind of thing, but I've learned that you also have children
Yes.
in a similar age. So why?
Yes.
Okay, then we
So-
go. And then the little tweak. You go like this. Triangle you build.
It should be something here. Like
Yes. Okay. Then you do it like this. That's it. The light brush.
Oh.
Easy way. And then we're almost done. Down here, and then it looks like this.
Yes.
Yep.
Yes.
And then it should be, you know, it should be able to fly.
I think it
Start.
could be great Ukrainian-Swiss collaboration in healthcare system, and it has to fly away the great future. So just like
Yes. Let's see. But maybe if we open up a little bit, there's a higher chance of this flying.
I do my best.
Shall we have a go?
Yes.
1, 2,
There.
3. 1, 2, 3.
Oh.
Whoa, yours was even flying farther. You see?
Yes.
Now your children will be very proud of you.
Thank you a lot.
Thank you.
Ми, україно-швейцарський проєкт «Розвиток медичної освіти», біжимо цей марафон у 4-й прикінцевий рік першої фази проєкту. Долучайтеся до наших забігів щосереди. Ми висвітлюємо те, чим живуть медичні освітяни, лікарі, медсестри, а також студенти-медики нашої з вами країни та світу. Ми прагнемо спільно пробігти цей марафон і обговорити важливі для вас теми, рішення та виклики. Розвиваємося разом для якіснішої охорони здоров'я.